Good evening, everyone, and welcome to today's wonderful evening. Mithu Kumar, Rajdeep Kar, Deepak Nayak, and many more who are all online. Finally, results came. Finally, the NEET PG 2024, very fast, the results came. So, if you prepared very well, you will know before exam or while writing exam that you are making it. Some students sent a good news that they got a very good rank, and some students are disheartened that they could not make it. But I want to tell you that once you reach a threshold point, once you have given enough time for revision, automatically, without your special effort also, in the exam hall you will perform. Now the question is, how do we reach that minimum threshold level? That is the whole journey, right? So some students till last moment can persist with confidence. Some students get succumbed to anxiety, tension in the last moment. So there are varied things, doctor, multivariate influence of our life as a medical student and a doctor. So that's the reason my advice to all the students, those who got good ranks, I'm not really needed at this hour, but I am definitely needed for all the people who could not make it. So to those who could not make it, I want to tell you that we all once upon a time were in the same ship like you. And another 3 to 4 months, if you persisted, if you happen to nail down those things that you could not revise in the last moment before the NEET PG 2023, automatically you will make it either in tomorrow's INICET or the next NEET PG and next exam. So with that spirit, we have only right to do karma, try, and then results are all an outcome of what we do an effort. So that's the reason, please don't dishearten. I'm there with you. Rose padenge until you get your dream branch and dream rank. So let's make the great beginning, doctor, with that prayer. Let us solve some of the questions in radiology. Can the online students can punch whether my voice is loud and clear? Mithu Kumar, Rajdeep Kar, Deepak Naik, and many more who are all online. Can you please punch whether my voice is loud and clear? Now, hilar shadow in a normal chest X-ray is formed by what? So, in the normal chest X-ray, you have the trachea, hilum, hilar shadow. Hilar shadow is formed by the upper lobe veins, bronchi, and pulmonary artery, but not lower lobe veins. So, upper lobe pulmonary veins, the major bronchi, pulmonary arteries, and lymph nodes. See, this is a very simple question. Very simple question. But sometimes we will be tempted to answer as, the answer as upper lobe pulmonary veins. But upper lobe pulmonary veins constitute, obviously, the hilar is what you need to remember. So this is the right paratracheal strip. This is the aortic nerve, the pulmonary artery, the left atrial appendage. This is the left ventricle. This is the paraspinal line. This is the right atrium. And you can see the left atrial appendage is here. Whenever it enlarges towards the right side and form shadow within shadow appearance is what you see with the appearance, is what you see with left atrial enlargement is what you need to remember. Now, doctor, right ventricular hypertrophy is a feature of all these congenital heart diseases. Tetralogy of Fallot, you are having pulmonary stenosis. That's the reason right ventricular enlargement will be there. Similarly, Ostrium, secundum, ASD, there is more blood from left to right, and overall the ventricle receives the regular venous return and also the left-sided blood. That's the reason right ventricle enlarges. Patent ductus arteriosus with pulmonary hypertension. Any pulmonary hypertension will lead to the right ventricular hypertrophy as much as systemic hypertension lead to the left ventricular hypertrophy. If there is a tricuspid atresia, blood is not coming to right ventricle at all. Why will right ventricle enlarge? Similarly, if there is a mitral stenosis, blood is not coming to left ventricle at all. Why will left ventricle enlarge is what you need to remember. Hampton's line. Where do we see this? We see it in gastric ulcer. So this is called the Hampton's line, which is pathognomonic feature of benignacy. If Hampton is there, it is not malignancy. It is a sign of benignacy of the gastric ulcer on the barium study is what you need to remember. With regard to the jejunum, so what is characteristic feature of jejunum? Jejunum has valvulae conniventes. Ileum is featureless. Ileum is featureless. Jejunum has valvulae conniventes, which is very characteristic feature of the jejunum is what you need to remember, doctor. What factor that interferes with radiation effect? If there is hypoxia, radiotherapy will not be effective. First, oxygen must be there. Hypoxia is a major factor that interferes with the radiation effect. What is the earliest lesion that is detected in patients with asbestosis? So, even before mesothelioma, bahut dur ki baat hai, pleural plaque. The commonest radiological feature is pleural plaque is what you need to remember. The overall heart size in Tetralogy of Fallot is either normal or relatively small. In Tetralogy of Fallot, right ventricular hypertrophy will cause the heart to enlarge up and right, boot-shaped heart. Boot-shaped heart. So that is the reason. Overall, if you look at the cardiothoracic ratio, the heart size is normal or relatively small in Tetralogy of Fallot is what you need to remember. If you take the overall cardiothoracic ratio, the heart size is normal. Only the upturned apex, which is called the boot-shaped heart. The boot-shaped heart of Tetralogy of Fallot is what you need to remember. Now, apex of the volvulus of the sigmoid colon. Where is it located, doc? It is in the left hypochondrium. So sigmoid volvulus is there, right? So whenever sigmoid volvulus is there, you are having the rib cage. So right hypochondrium, you have this liver. Left hypochondrium, you have the spleen. So the sigmoid volvulus, typically the apex is located in the left hypochondrium, and a coffee bean shaped loop is what you classically see. So what is this called? This is called the beak sign. The beak sign on barium enema whenever there is sigmoid volvulus, and typically the apex is located in the left hypochondrium is what you need to remember. Early gastric cancer generally indicates what? Gastric adenocarcinoma, which is confined to the mucosa and submucosa, is called early gastric cancer. So, what is the definition is important. Early gastric cancer is confined to mucosa and the submucosa is what you need to remember. On X-ray, Renal caliculi, which is not seen, that is radiolucent, is which one? So we need to remember it is the uric acid stone, which is radiolucent. Otherwise, cystine stone, triple phosphate stone, calcium oxalate stone, they're all radio opaque. So what are the stones which are radiolucent, doctor? Uric acid, xanthin, cystine, matrix protein. These are the ones which are radiolucent renal caliculi is what you have to remember. Calcification of the meniscal cartilage, where do we see it? Whenever there is any pseudo-gout, then there is a calcification of the meniscal cartilage is what you need to remember. Adrenal gland enlargement, if you want to see what is the best way, always CT abdomen. There are certain scenarios where CT abdomen is the best, like bony architecture, pancreas, small intestine. All these things are wonderful investigation is CT. So adrenal gland enlargement is best seen on CT scan is what you need to remember. Now, doctor. If there is any calcification in the intracranial lesion, what is the best way that you can be able to diagnose it? It is the CT scan which can be used to identify the calcification of the intracranial lesion. With regard to the blunt injury of the kidney, cortical rim sign on CT scan, it suggests devascularization. Whenever blunt injury is there, about 95% of isolated renal injuries are all minor. You can manage them conservatively. Whenever any hematuria with hypotension is there, there is an increased risk of significant renal injury. So this is how, doctor, cortical, a wedge-shaped hypo-enhancing lesion in both the kidneys is what you are able to see. The cortical rim sign is what you should remember. What is the conventional daily dose per fraction in external radiotherapy? It is 180 to 200 centigrade. 180 to 200 centigrade is the conventional daily dose per fraction. In a week, about 900 to 1000 centigrade dose is given, and the entire course consists of 450 to 600 centigrade over a period of 5 to 6 weeks is what you should remember. Radio-strontium bone scans. Where are they positive, doc? Whenever there is any osteogenic sarcoma. The radio-strontium bone scanning, it's a diagnostic method of choice to detect the metastatic lesions in the bone is what you need to remember. Breast lump in a 40-year-old lady. What is the best way to identify? Excisional biopsy any day. So if you do mammography, there is only 58 to 69% chance, and it is, if the lesion is less than 1 centimeter, only 8%. So it is a screening modality, but not the best diagnostic measure. That's the point you need to appreciate. So excisional biopsy is the best method. Missed IUCD, how can you diagnose, doctor? CT scan. CT is the most sensitive and most specific test to identify the IUCD. What are the indication for penile angiography? Ischemic erectile dysfunction, priapism, arteriolar disorder. Pioneer is more just like Dupuytren's contracture. Peyronie is more with the formation of the fibrosis along the penis. It has nothing to do with vascularity of the penis. That's the reason penile angiography is not much useful. So what are the indications for penile angiography, doctor. Penile angiography. Ischemic erectile dysfunction. Priapism, arteriolar disorder is what you need to understand. Now, ionizing isotope which is used therapeutically. Gold. Gold is the gold 198. It has got 2.7 days of half-life. It emits beta and gamma rays, which is used in the form of grain implants in the tissues. And it is used in the treatment of malignant ascites and pleural effusion, is what you need to remember. So what are the most sensitive tests for metastatic deposits in the bone? Any given day, it is the isotope scan. Whenever bone scan, which has a high sensitivity for many metastatic tumors of the bone, is what you need to understand. 45-year-old female, there's a lump in the breast. Examination of the lump is firm to hard in consistency. How do you want to confirm the diagnosis? So it is the open biopsy. Always, whenever excisional biopsy, any word about biopsy is there in the options, and examiner is asking investigation of choice, definitive diagnosis, etc., you need to jump to biopsy, because biopsy is like a Supreme Court judgment. Earliest demonstration of the placenta, when can you do it? On gestational age. At what gestational age? By about 12 weeks of gestational age, you can demonstrate the placenta on the ultrasound, is what you need to remember. So, doctor, can the online students can punch? Is the voice loud and clear for all of you? So there are about 200 radiology questions which I wanted to discuss in addition to the theory. So when you listen to theory, when you listen to high yield facts, you get a grasp. But at the same time, when we are also practicing the discussion of the question bank, then it will be a little more interesting, right? So good. Thank you, Mithu, for the feedback. So good, doctor. So माहौल बहुत tension है. There are some students celebrating at this time, very happy, very proud, very prodigious, completely relieved. Lifetime achievement award like Oscar, right? But some students are clueless. Oh my God, I tried, but why I did not make it? Don't worry. The point is, you tried, but that three phases. One is you should go through all the high yield facts. You need to do significant MCQ practice of all the 40,000 PYQs, previous year questions. Then at least 20-30 mock tests you should do comfortably. So once you do all this, doctor, at least 3 to 4 months of your time you have given, automatically nobody will stop you from getting the top rank. So that is the reason I want to tell you, I want to sing a lullaby tonight to all my students who could not make it, because there's no point in clapping and clamoring about those who won. Those who won would have won even without my help. There's no doubt on that. Few of them probably because of a little inspiration we could add. But my need is always there for my wonderful students who are having that zeal to win, who want to be a winner at any cost. For them, I am there always. So, कुछ भी डरना नहीं. थोड़े दिनों में INICET एग्जाम भी है, उसका एप्लीकेशन डालो और देखते देखते कितना देर, little rains, following rains, there is a notification and there is once more a NEET PG. देखते देखते next NEET PG आएगा, देखते देखते next INICET आएगा. So no tension. So, and there is no other way, we have to get into the top 10,000 ranks. There is no other option for us, right? Do we have any option after finishing MBBS? Already we invested our 5.5 years of wonderful, youthful life into MBBS. So there's no other option that we have to read and come out of it, right? So please be with me. Don't dishearten. Have energy. We also cried at one point of time when we were not qualified in exam. Later we became toppers. It doesn't matter, right? So let's work. So doctor, Rasmussen's aneurysm, what does it involve? Rasmussen's involve pulmonary artery is what you need to remember. So Rasmussen's is often the cause for the bleeding, hemoptysis, right? So there's a weakening of the pulmonary artery wall because of the adjacent cavitary TB. And from the TB cavity, adjacent blood vessel become aneurysmally dilated, which is called Rasmussen's aneurysm in TB, is what you need to remember. Emifostin, which is a rescue drug used for preventing the cisplatin toxicity. Typically, what does it protect? Salivary gland, skin and GIT involvement are all prevented by emifostin, not the CNS, because emifostin does not cross the blood-brain barrier, is what you need to remember. Now, doctor, hot nodule, where do we see? In adenolymphoma, we see the hot nodule is what you should remember. Adenolymphoma, papillary cystadenoma, lymphomatosum, Warthin's tumor, it is the second most common tumor of salivary gland. Age is above 50, male more than female. Most common salivary neoplasm is adenolymphoma. With regard to the lymphomas, what is true? Nodal extension is contiguous in Hodgkin's. Extranodal disease is common in non-Hodgkin's. And testicular lymphoma is the most common testicular tumor in the people aged over 60 years, is what you should remember. So axial peripheral mesenteric are commonly involved in non-Hodgkin's lymphoma. So that's the carry home message in this question. With regard to the venous thromboembolism, duplex ultrasound is highly sensitive specific investigation for symptomatic proximal leg DVT, is what you should remember. So any given day, DVT can identify by the color Doppler. You look for the pulsatility, resistance in the blood vessel, etc., etc. Rugger Jersey spine, right? This is called Rugger Jersey spine. So Rugger Jersey spine, where do we see that? This is increased whiteness. Then there is a lucency in the middle. right? It looks like the rugger jersey. Renal osteodystrophy, we see rugger jersey spine. Which agent for uterine artery embolization? Polyvinyl chloroalcohol is used for uterine artery embolization. Predominantly gamma rays are emitted by technetium-99 emits gamma rays, and it has a shorter half-life of 6 hours, is what you need to remember. Now, increased radioisotope uptake. Where do we see? Primary bone disease, osteomyelitis C.Paget, in all this, there is an increased radioisotope. Whereas in multiple myeloma, if you take note of it, multiple myeloma, it is all osteoclastic activity, not osteoblastic. That's the reason negative radioisotope scan, otherwise called cold nodule, is the feature of the multiple myeloma, is what you should remember. So no tracer uptake into bone. What conditions you should remember? Multiple myeloma, pseudoarthrosis, healed fractures, fibrous cortical defect, then osteopoikilosis. All these need to be remembered for no tracer uptake into the bone. Fallopian tube patency is checked by what? Histosalpingogram, ultrasound, hysteroscopy, all of them will help you to identify the fallopian tube patency. So how do you identify? Carbon dioxide, HSG, sonosalpingography, Sion test, laparoscopic chromoperturbation. They're all the tests used for tubal latency detection, is what you need to remember. Now, in which of these cialography is contraindicated, doctor? Whenever acute peritonitis is there, don't try to send a contrast into the salivary duct. Ductal calculus, chronic peritonitis, recurrent cialidinitis. In all this, you can use the cialography, is what you need to remember, which is not a cause of elevated dome of the diaphragm. Subphrenic abscess, lobar collapse, diaphragmatic paralysis, all of them will lead to the development of elevated dome of the diaphragm, whereas a large pleural effusion will lead to depressed dome of diaphragm, is what you need to remember. Now, with regard to the tension pneumothorax, good to see 12 online classmates. Excellent, doctor. So, within no time, INICET. Hardly we have 14 plus 30, 44 plus 6. 50 days time is there, doctor. Only 50 days. Only 50 days time for INICET. So, no point in waiting and watching or bleeding about NEET PG result. Just you need to wake up, re-emerge quickly. Those who can re-emerge quickly are the winners. Please remember that. Okay? So, typically, contralateral mediastinal shift, kinking of the great wings, depression of the ipsilateral dome of diaphragm. They're all the features which are seen in tension pneumothorax. Ipsilateral dome of diaphragm become depressed because on one side, the lung is all compressed and tension pneumothorax, all air will blow the pulmonary, the pleural cavity, and that lead to depressed hemidiaphragm, is what you need to remember. So, this is how a large right pneumothorax will, this is a normal side diaphragm. This side, large pneumothorax, this is all no bronchovascular markings. This is the lung. So, that will cause the depression of the hemidiaphragm is what you should remember. For acute pancreatitis, what is the best investigation? CT scan is the best investigation for acute pancreatitis. Hand-Schuller-Christian disease, eosinophilic granuloma. You find geographic skull, vertebra plana, where there is a collapsed vertebra, sharply defined osteolytic lesions in the mandible called floating teeth. They're all the classical features. So what is this called? Floating teeth in a child with eosinophilic granuloma. And lateral radiograph shows the vertebral bodies which are collapsed. So typically there is a loss of height of the vertebral body, which is called vertebra plana, is an important feature. Geographic skull is another important feature where multiple lytic lesions, bone within bone appearance, right, is typically the histiocytosis is what you need to remember. So, malignant gastric ulcer on barium enema, barium meal, what do you see? You don't see Hampton's line, because Hampton's line is a sign of benignancy of the gastric ulcer, Irregular ulcer margins, no extension beyond gastric wall, irregular nodular radiating folds. They are all the features of malignant gastric ulcer is what you should remember. So Hampton's line is a thin straight line at the neck of the ulcer that represents benignancy is what you need to remember. Similarly, Carmen's meniscus sign, large ulcerating mass along the lesser curvature aspect of the gastric antrum is called Carmen's meniscus sign. What is this called? Carmen's meniscus sign, which is the classical feature of malignant gastric ulcer is what you need to remember. Now, while assessing the cardiac shadow on the PA view of the chest radiograph, what is false about it? Whenever left atrial enlargement is there, there is a double right border that is called shadow within the shadow appearance. Cardiac apex is displaced inferior-laterally down and out in left ventricular enlargement. Lateral prominence of the right heart border indicates right atrial enlargement. So on the right heart, so right atrial enlargement enlarges to right, left atrial enlargement also enlarges to right. That's the point you need to remember. So this is what left atrial enlargement, where shadow within the shadow appearance in a patient of chronic MR. Right atrial enlargement will cause the enlargement of the right heart border is prominent, and the retrosternal space is fully filled with the right heart. Normally there will be some gap, retrosternal gap. Here the gap will not be seen whenever right atrial enlargement is there. Left ventricular enlargement, there is a posterior displacement of the posterior border of the heart is what you need to remember in relation to the shadow of the IVC. Okay, so always left-sided chambers are posterior, right-sided chambers are anterior. Whenever right atrial enlargement is there, all this will be filled with the shadow of the right heart is what I want to underscore to all of you. Now, enlargement of the left ventricle typically will be down and out, typically, and the shadow of the aortic arch become flattened. This is what you typically see. Now, which is not a cause of calcification of the anterior mediastinal mass. So whenever there is any germ cell tumor, aneurysm of ascending aorta, or any lymphoma of the radiotherapy, after radiotherapy, they all lead to the development of calcification of anterior mediastinal mass is what you have to remember. So this is the anterior mediastinal mass calcification is identified by the presence of typically calcification of lymphoma. Tension pneumothorax, how do you identify? Whenever contralateral mediastinal shift is there with ipsilateral diaphragmatic depression, then it is indicative of tension pneumothorax. So whenever tension pneumothorax is there, doctor, ipsilateral diaphragm is depressed. And contralateral mediastinal shift, the tracheal shadow becomes shifted to opposite side is what you should remember. Now, what is the investigation in case of a suspected gallbladder stone? So ultrasound will help you always the initial investigation for whenever you are suspecting gallbladder stone. ERCP is the method of choice for investigation of obstructive jaundice. The most common complication after ERCP is acute pancreatitis. And which stone is resistant to lithotripsy, doctor? Cystine duct. Cystine duct is resistant. In adenomyometastasis of the gallbladder, what do you get? Comet tail artifacts. All this we discussed in our regular theory. And PTCA also is used for the assessment of obstructive jaundice. Important screening test in pulmonary embolism, doctor. D-dimer, no PTE. That much you can say. But if D-dimer is positive, it does not mean PTE is there, but the probability is there. At least it has got a negative predictive accuracy. Now, about cobalt-60. Cobalt-60 is an artificial radioactive substance, not natural. Gamma ray emitter and even beta ray emitter is cobalt-60. It has a half-life of 5.26 years, and it is often used in both teletherapy and also brachytherapy, is what you should remember. Very nice to see 17 online classmates. Excellent, doctor. So don't bother about the results. जो आया है वो आया है. If you got it, congratulations. If you didn't get it, no problem. We are there with you to prepare along with you every day. That's our promise. Only 50 days time is left over for INICET. You should declare a war on INICET. Another 50 days, you should do full revision. I'll make you to do the total thorough revision if you give 50 days of your time to me, right? So that is very important, doctor. Because खाली कर्मा करने में हमको अधिकार है, उसका फल पाने में हमको कुछ भी नहीं है. फल मिलेगा, ऑटोमेटिकली मिलेगा. Today you see some of the friends who are toppers, but at one point they were self-doubting, they were struggling, they are anxious, they are passing through all the phases, but at the same time they are filling the gaps, strategically preparing for the exam. And today's result is not yesterday's effort. It is an effort of at least 3 to 4 months of a consistent effort. Intermittent, at least 6 months of intermittent effort is there. And till now in the history, those who did effort, who did not get seat, vaisa kuch bhi nahi hai. Those who did effort, they got the seat. Be very sure about it, doctor. So in the nuclear bone scan, all the following disorders will show as hotspots. Multiple myeloma, it is the osteoclastic activity, not osteoblastic activity. That's the reason it won't take increased uptake. That is osteomyelitis, hyperparathyroidism, metastasis to bone. They're all highly vascular tumors. Lot of osteoblastic activity. That is the reason they will be shown as hotspots, is what you should remember. Now, breast carcinoma on mammography. How do you identify? Calcified nodules, spiculated margins, distorted architecture. They're all the cardinal features of malignancy on mammography. The intensity of the color on Doppler is determined by what? Intensity is velocity. And what color is decided by direction. So various colors indicate the direction. Intensity of the color is decided by the velocity. Is it retrograde, away from the probe, towards the probe? That's how you look at it. Now, with regard to the osteogenic sarcoma, lesions appear like a moth-eaten with ill-defined edges. Cloud-like areas of sclerosis will be there with malignant osteoid calcification within the mass. Codman's triangle, multilaminated, spiculated, sunburst reaction indicate that there is an aggressive process. So this is how typically the radiographic appearance, you can see the sunburst appearance is what you need to remember. Codman's triangle, a mixture of lytic and sclerotic lesions, which is classical feature. There is an extension into the soft tissues of the osteogenic sarcoma. Periosteal reaction would show multilaminated, spiculated, sunburst appearances. Osteogenic sarcoma is what you should remember. With regard to simple bone cyst, what is the wrong statement? The long axis of the lesion parallels that of the long axis of the tubular bone. A thin sclerotic margin is very typical finding. Well-defined geographic lesions with a narrow transition zone is classical of simple bone cyst, is what you need to remember. Simple bone cysts are not in diaphysis. Diaphysis are what? Diaphysis को क्या बोलते हैं? Shaft. Shaft में नहीं रहता. Metaphyseal area में, intramedullary metaphyseal area is the site of location of simple bone cysts, immediately adjacent to the physis, not in the diaphysis. Only two lesions are diaphyseal. What are they? Ewing's sarcoma, osteoid, osteoma. They are diaphyseal, is what you have to remember, doctor. Radiological sign which is important to differentiate a simple bone cyst from other non-lytic bone lesions is fallen fragment sign. Typically, there is a fragment which is fallen. Fallen fragment sign is the migration of the fragment of the bone to a dependent portion of the fluid-filled cyst, is a characteristic feature to say that, oh, this is simple bone cyst, is what you need to remember. Fallen fragment sign. With regard to the chest radiograph, decubitus is useful to differentiate pleural effusion from consolidation. Decubitus. Lordotic view picks up the Pancoast tumor. Expiratory view helps in pneumothorax. So decubitus, if you want to differentiate pleural effusion from consolidation and loculated effusions from free fluid in the pleura, if the thickness of the linear fluid exceeds 1 centimeter, it is mandatory to pleural tap should be done. So lordotic view is good for pancreas. Expiratory view is good for pneumothorax. At least 75 ml pleural fluid for the blunting of the costophrenic angle at the lateral chest radiograph and 200 ml on PA chest radiograph. And on lateral decubitus, as small as 5 ml of fluid are possible, is what you need to remember. So which lesion that characteristically look in the upper lobe of the chest radiograph? Ankylosing spondylitis lead to upper lobe fibrosis. Langerhans cell histiocytosis is also upper lobe. Silicosis also upper lobe. You can remember, silica means sand. Sand is below, but lesion is above upper lobe. Asbestosis क्या किसके लिए इस्तेमाल करते हैं? आपके रूफ टाइल के लिए. Tiles are on the top, but asbestosis is in the bottom. Lower lobe is involved. That's how you should remember which lobe is involved in the fibrosis, doctor. So, thank you very much for attending this wonderful evening with Dr. Murli Bharadwaj. Many miles to go, many things to do. Shortly, from 20th onwards, we are starting the classes in our new 300-seater classroom in RTC Crossroads near Gandhi Medical College in Hyderabad. So please, if you are in Hyderabad, be my guest. I'll be very happy to be part of your journey to become the topper. And if you are not from Hyderabad, every day we will meet, 2-3-4 घंटे पढ़ेंगे, right? And we will do the revision of entire subject. Good night, and don't worry about the results, whatever. But if you got good rank, congratulations, right? Thank you. Good night.